So I think what we'll do, okay. What we will do is, I was going to have my committee members ask their questions first, but I'm here and they aren't. So I want to thank you all for your testimony. I'm going to recognize myself for 5 minutes, and then I'll yield to Mr. Wilson, and then others will be here by then. We're going to have a whole series of what we call, excuse me, Republicans, nuisance votes. So we'll be running back and forth, but they're 15-minute votes, and they won't be held open very long. So again, thank you, and I recognize myself for 5 minutes. Mr. Dombey, I have a question about these third-party agencies. Are they not for-profit agencies?
Home care agencies are both not-for-profit and for-profit. Some are government-based agencies. The largest home care agency in South Carolina, for example, is the Department of Health and Environmental Control, which is a government agency that runs the health department and such as well.
Okay, so when they pay somebody like Ms. Butler, say $9 an hour, what do they charge the client? I mean, where's the profit margin? I mean, the overhead margin.
Yeah, in most of the instances, they're not charging the client. Instead, they're receiving reimbursement from a public program like Medicaid. So they're getting a fee schedule rate. By and large, the rates vary tremendously across the country, but in a situation normally for what we call the home and community-based waiver programs, we see hourly payment rates to the home care providers as low as $9.63 and as high as the low 20s. Within that range, you've got a median probably in the $15 range.
And so the healthcare worker takes the whole amount home? I mean, other than taxes, et cetera?
No, the healthcare worker takes whatever wage is that they get home, right, and the healthcare provider then finances other aspects of the delivery of services. For example, most of the states, when they pay an hourly rate for the home care aide, personal care attendant, do not pay for the travel time, yet that's an hour worked for the worker that the employer has to pay. They do not separately pay for training. They don't separately pay for criminal background checks. They don't pay for any of the other overhead aspects that are there in the delivery of the service. They pay that as part of the fee schedule rate to the provider.
Okay, thank you. Now, Ms. Butler, I'd like to ask you a question about something Mr. Dombey did say. He said that what would happen if we pass this legislation would be that you would no longer be privileged to work over a 40-hour week without getting overtime. Right now, you can be forced to work over a 40-hour week without overtime. Is that all right? I mean, you're okay not working over 40 hours, aren't you?
Well, the overtime will mean to me, it will be $1,500 more a year. For some people, it will be a drop in the bucket, but for me, it will be quite a lot of money because of the cost of living the way it is in New York. But like he's right, some agencies will try to get the chance to cut down your hours. Then it will be very bad. But at the same time, they can, not with the sick people the way they are.
So, so you see this rather than ensuring that then the other part of the day would be paid, somebody else would come in and earn.
But don't that would be
time.
Very disturbing to the patients? Because if we take into consideration the emotional problem of the elderly, having people walk into their home every certain amount of hours so they won't pay the overtime, so, how are we benefiting these people as it is?
All right, I appreciate that very, very much. Good input. So, Mr. Becker, talk to us about the patient or the elderly person and what the difference between quality care and turnover care means to them.
Well, I think The important thing to recognize here in terms of the quality of care is that the most important factor determining the quality of care is whether there's an available caregiver. And the greatest threat to the quality of care here is the threat that there won't be enough caregivers available to provide the care. And to keep these workers in the margin of the economy, to categorize them as less worthy than all the employees who are covered by the Act is only furthering that threat. In terms of the overtime question, when the Act was passed in 1938, when it was extended numerous times, including in 1974, this argument has always been made that protecting workers is actually going to turn around and harm workers because their hours are going to be cut and their wages are going to be cut. So this is really not an argument against closing this loophole. This is an argument against the principles of the Fair Labor Standards Act itself. Right. Overwork is generally a problem in the healthcare industry, in hospitals, in nursing homes, in home care. It's generally not desirable to have people working long hours in this industry in particularly, but in all industries. That's the philosophy of the Fair Labor Standards Act. The statistics show that very few clients receive more than 40 hours of care per week. So to have that care provided by individuals who don't work long hours will not lead to significant problems in terms of the discontinuity of care. So we think that extending the Act, including the overtime provisions, will have a positive effect on the quality of care.
Thank you very much. Mr. Wilson.
Again, Ms. Butler, thank you for your service. And in our home state of South Carolina, it's very frequent in obituaries to see the companion care personnel listed as family members, which is truly an indication of the deep affection that the family develops with people in your profession. And as we're facing these very important issues today, Mr. Robinson, as drafted, do you believe that H.R. 3582 goes beyond the scope of the issue decided in the Long Island Care and the questions raised under the Department of Labor regulation at issue in that case? In what way do you believe this bill goes beyond the Long Island Care?
Thank you, Congressman Wilson. Yes, I do believe it goes beyond the Supreme Court decision. Can you hear me? At issue there was the validity of the exemption applying to third-party caregivers employed by third parties. The way this legislation is drafted, it goes beyond that because it would deny application of that exemption to a babysitter, to a companionship provider who works more than 20 hours. It also has a provision in there that it sort of compounds, if you will, layers the terms intermittent and irregular in the statutory provision that already has the term casual basis in it. So it sort of is, I might say, fraught with confusion in that sense because you're layering on terms that are not defined, even though the casual basis is in the regulations. So it could impact the babysitter that was not at issue as well in the Supreme Court case.
Mr. Dombey, you really have the perspective of an attorney, also being real world with the association, and in that context, were H.R. 3582 to become law, what do you predict would be the immediate consequence for companion care workers, the clients they serve, employers, and government agencies? And you've already spoken about something Mr. Becker mentioned, and that's setting the price. Who's doing that? What do you predict the long-term consequences to be?
Well, as much as I have a crystal ball, I base it on some experiences we've had, which is when a new cost comes to the employer, in this case the home care provider, and that cost is not covered by the payer of that service, Medicaid or Medicare, whatever, they then get into a cost avoidance mode. And with respect to home care aides, I think they're offered 3 options and a combination of them that they can take on an immediate basis, because Experiences also say that the payment systems do not respond immediately and may never respond at all. The three choices that they would have would be to avoid overtime compensation obligations by controlling the number of hours worked, and some workers might find that beneficial. They can reduce the base wage that's paid to that worker so that they could accommodate then an overtime on that, but I don't think anybody's real happy with taking $10 an hour and reducing it to $7.50 so you can afford to pay overtime when that occurs. Or they could dismantle or some way diminish the limited benefits that are their employee benefits that might be available, whether they are a limited health plan or pension benefits. Those are truly the only options that are available in a cost avoidance mode that occurs, none of which in my mind end up benefiting either the consumer or the worker at that point, and certainly don't benefit the employer, because the employer then is probably out there having to recruit more staff because staff leave as a result of those kinds of changes.
And Mr. Robinson, you had cited about the 20-hour per week provision in subsection B of H.R. 3582. Again, could you restate your concerns about that?
Yes, sir. The way this statute is drafted, it could exclude from the exemption. In other words, overtime would apply to anybody, whether they're hired by a third-party employer or directly by the recipient of the services, if they provide more than 20 hours a week. That could be the babysitter, for example. The 14-year-old child labor regs limit the number of jobs you can perform. You could have a babysitter who performs more than 20 hours a week who could be impacted by this bill. You could have the person who works directly for the recipient of the services, if they work more than 20 hours a week, would be impacted by this bill. So it has far-reaching consequences beyond just what was addressed in the Long Island Coke case.
Thank you all.
Thank you.
Mr. Bishop.
Thank you, Madam Chair, and thank you very much for holding this hearing. Dr. Seavey, in your testimony, you indicate that the vast majority of home care workers are already paid the minimum wage. And Mr. Dombey, you do not dispute that. So that's not in question.
No,
Okay.
it's not.
All right. So what we are talking about here in terms of economic impact is primarily in terms of overtime pay. You have indicated, Dr. Seavey, in your testimony that the vast majority of home care workers do not work more than 40 hours per week. Do you have an approximation of what proportion of home care workers do on a regular basis work more than 40 hours a week?
Well, the only approximation that I've seen is from a federal data set called the Current Population Supplement, and the one from March 2006 showed 15% of home care workers.
And
It's a highly constructed number. They don't ask you how many hours per week did you work overtime.
but it's a number that's arrived at in good faith. I mean, it's 15%.
Yeah, it's a very derived number. I think it's on the high side.
All right. And is there any approximation of the number of hours of overtime that this 15% approximately of the workforce work?
I don't know that.
Right. Because it seems to me, and I mean, the average salary is $9.95 an hour, so $10 an hour. So we are talking about $5 an hour of premium pay, I'll put premium in quotes, for a small minority of healthcare workers. And so what are we talking about? 3 hours a week of overtime? 4? I mean, are we talking $15 a week per employee, per 15% of the employees? I mean, is that about right?
I think that's in the range, but another way to look at it is that if this bill were to pass, it's not the case that 800,000 home care workers would have any change come to them at all.
Precisely my point. And so I guess
Right.
my question is really to Mr. Dombey, which you have predicted rather significant consequences. You've talked about denial of overtime, you've talked about diminution of care, you've talked about withdrawal of health benefits. You've laid out a fairly bleak scenario in the event that this legislation is passed, but it seems to me that the economic consequences, first off, will be attributed to very, very few workers, and they are relatively modest. So my question is, how do you reconcile this, at least apparently, very modest economic consequence Take that as fact one. Fact two, that we already have 16 states in which this appears to be working reasonably well without the onslaught of the consequences that you are predicting. How do you then still take the position that these consequences are consequences that ought to deter us from trying to protect a disadvantaged segment of the workforce?
Mr. Congressman, there's several factors that go into consideration there. I think we do not know all of what we really need to know about the economics of home care, and in particular the pay scales and hours worked of home care aides. And I would submit that because of those 16 states, one of the reasons why there's limited overtime compensation that is paid and overtime that is worked is because of the obligation to pay the overtime compensation. And you know, I don't know if
May I just interrupt you for a second? Presumably overtime is offered or scheduled because there is a need for it, correct?
It's a combination of offered and desired, the workers looking for additional working hours in order to make ends meet.
No, but I guess my question is, if overtime is withdrawn or withheld by the employer, how is the care provided?
If overtime was withdrawn, how is the care
withheld.
provided? With an additional caregiver.
Okay, but with a paucity of caregivers, my understanding is that this is one of the fastest growing segments of our economy, and we don't have a workforce that's keeping up with the demand. How is that possible? How is that functionally possible?
At this point, there is sufficient supply of workforce to meet the existing demand. We don't believe that that will continue as the graying of America demands
wouldn't
more.
providing overtime be a more cost-effective way for the employer of providing for an increased demand, thereby saving on recruitment costs and training costs? So, I mean, even if there are adverse economic consequences to paying slightly more per hour to a very low number of workers for a very low number of hours, wouldn't that be offset by training, savings in training, savings in recruitment?
We don't know, but that is actually the basis of the discussion that Dr. Seavey and Mr. Claypool and I had during the break, which was that there is some theory that it would be cheaper for the business to provide higher wages and overtime compensation than to take on the cost of recruitment and retention and everything that goes with that. And that what we actually had, I had discussed with Dr. Seavey's organization some months ago, and want to continue those discussions based on our further discussions today of joining forces and doing an analysis, because if we can present a business model to my constituency that says it makes sense to do this for everybody's interest, then we're going to sell that from here to California.
Okay, Mr. Klein.
Thank you, Madam Chair. To the witnesses, thank you very much for being here today. It was really terrific testimony. It's great to have a panel of experts like this. We've just been advised by staff that the majority leader is going to shut off the votes very rapidly after the 15 minutes, so the normal slack that we've had is taken away from us. Let me just say that this issue is really, really pressing, as many of us baby boomers are now looking at our parents and the needs for home health care or assisted living or nursing home, and so the demand is growing. Mr. Dombey, I think you're right that we're going to have a supply and demand problem here. So I had some questions. Perhaps we can do them for the record, but let me just say thank you very much for your testimony today. And I yield back, Madam.
Thank you, Mr. Klein. You guys all go. I'm going to close the hearing today. I'd like to say two thoughts have come to mind. In Ms. Butler's case, I thank you very much. You're the one that does the really hard work. And Mr. Claypool, thank you, because you know how necessary all this is. But the rest of you, you've been great experts. But in Ms. Butler's case, for 2 hours more a week, you're going to pay somebody's travel to and from? No way. So, I mean, the overtime, it comes out ahead. I'm sorry, we can't do anymore. Oh. But, and then I'd like to say the other thing that comes to mind is that we really need a national health care system in this country. What a difference that would make. So I'm going to tell you again, thank you very much. And if we weren't going to have these series of votes, we'd keep on going for the rest of the day. I want to say that members have, as previously ordered, members have 14 days to submit additional materials for the hearing record. Any member who wishes to submit follow-up questions in writing to the witnesses should coordinate with the majority staff within 14 days. Without objection, this hearing is adjourned. Thank you.